I'm Sugar. I'm a purebred Pomeranian, and I have glaucoma in my right eye. Glaucoma is a common problem for Pomeranians, also for Basset Hounds, Cocker Spaniels, Beagles, and other breeds. But we are far more likely to suffer from the disorder as we age. Kitty and I are senior Poms now. I've had eye problems for several years. Mom, Dad, and my vet have been watching me very closely. I lost my vision quite some time ago, but it's just been recently that I have started showing signs of glaucoma. Some signs that your dog might have glaucoma include headaches, excessive blinking, a cloudy appearance, dilated pupils, redness in the whites of the eyes, and partial or total vision loss. If your dog has any of these signs, you will want to quickly have them checked. My vet has been checking my eyes and knew we had a problem when the pressure in both eyes was too much. I have been having eye drops in both eyes for some time to slow the progress. The pressure in my right eye has gotten to be too much. As you can see, it is quite larger than the other one. And so the only option we had was to remove my eye. The surgery is called eye enucleation. That is what this video is about today. My surgery and recovery.
Okay, bye, Sugar. Be so brave. We'll see you soon.
You'll be fine, Mama.
If you think poorly of my family or my vet, please stop watching, and we don't need to hear about it. But if you find it helpful, please hit the like button. This is an informative video for those that may be having the same problem. If your dog has eye problems, we'd love to hear your story in the comments. If you are interested in what it cost in 2020, we will post our bill here and you can pause the video, because we won't be covering that.
Hey, Sugar. Hey there. We're just getting home. I just picked her up from the vet. He said that everything went well and she did such a good job, and she's going to be lethargic for 24 to 48 hours because she's a little bit older, so it'll take longer for the anesthesia to wear off. She won't be feeling much like eating, but we need to see if we can get her to eat and drink something in about an hour. So we're going to take her inside and see Kitty and Indy, and neither one of them can touch her because we don't want there to be any chance that they might touch her eye. Hi, Kitty. Look who I brought home. You want to say hi to Sugar? Okay, come here. You're actually not allowed to say hi to Sugar because we don't want you to lick her eye.
Hi, Sugar.
Sit down. Sit down.
Set her down.
Yeah, we have to keep them apart and her apart.
Something doesn't smell right.
Okay, here. You can say hi to Sugar.
Let me check.
You can't touch her face. Oh, did you miss her so much? I know. I know. Poor Sugar. She's had a rough day. Okay. No, you're so happy to see Sugar. She can't play, Kitty. You okay? She's so chill.
The following pictures are not pretty, so you may want to use discretion with those that are viewing this. The doctor's instructions for recovery are as follows.
If Sugar still isn't behaving normally after 24 hours, feel free to give us a call. Sugar also may be groggy, and her safety is our top priority. Watch Sugar closely and restrict her activity, especially around stairs and furniture, to prevent injury. If she needs to be alone, she should be kenneled or kept in a confined area such as a bathroom or laundry room.
I was also prescribed wonderful medication for pain and inflammation. As far as eating, they said,
Since Sugar has been fasting, it is recommended that you start refeeding with small, frequent amounts of food and water. As long as there is no vomiting, you may proceed with her normal portions.
I didn't want anything but my mom. Then hours later, I did decide I was super thirsty.
Kitty wants to see Sugar, and we won't let him, huh?
The doctor also said,
Please restrict activities. No outside play, no jumping, running, or roughhousing for 10 to 14 days. Leash walks are okay.
I slept well all night. I was still sleeping off the anesthesia. For the incision care, they said,
Check incision daily for swelling, redness, discharge, and odor. If these occur, please call us. Sugar has sutures that should be removed. Please return in 10 to 14 days to have them taken out. No bathing till the sutures are removed.
I also had to wear that awful collar until Mom got me a better one. It was to prevent me from licking, chewing, scratching, or rubbing the incision, especially when I was not directly supervised. Day 2, my new collar came in the mail, and boy was that a relief. The collar we got from the vet was so hard, and it would dig into my neck. Plus, guess when I ran into things, it was so loud on my little ears. The soft collar was so much better. It was more comfortable to lay on. It didn't dig into my neck. I didn't get sweaty in it, and it was so much quieter. Mom will put the link in the description where we got it. It was nice to get the tape off of my arm where the IV was. But they shaved my hair and it took forever to grow back. The doctor told Mom if I wore socks on my feet, I could have the collar off when I went out to potty and when I eat my dinner. They are not my favorite, and they kept falling off. After a few days, Mom didn't make me wear them because I didn't try to touch my face.
She's hungry.
Today, day 2, was the first time I felt like eating anything besides water, but still didn't eat much.
Here, make sure she doesn't try to scratch your face.
Go ahead
Okay to
and
have
eat.
company?
Go ahead and eat.
You have company while you eat? She's like, what are you doing here?
Kitty was so concerned about me. He is a good friend.
What are you doing? You told me you were hungry.
This is the first time I went potty. Last night, Mom left the cone on and I couldn't smell anything, so I couldn't go. I was so relieved to get the cone off and be able to go potty. When I was done, I just wanted to go back inside.
You ready to go back inside? Don't want to enjoy the outside for a minute? Okay, hang on.
Okay.
Okay. You're done eating, you gotta have this back.
When I had the collar on, I hardly moved. It was so strange.
Pretty girl.
Okay, come on.
The cone of shame.
Come on.
Mom softened my food with water. So then I started eating better. I was so hungry. But most of the time, I just wanted to sleep and rest. Day 3, I started feeling much better.
Hi, Sugar. You're doing so good walking around with that on. Are you getting used to it? Yeah.
I got up and walked around more with my cone on. It wasn't easy. I bumped into a lot of things. I was glad I didn't have that noisy plastic cone.
Sugar, you're doing so good. You're doing so good. Okay, watch out. Here's the chair.
When I went out to go potty, I was so glad I didn't have to wear that cone. Being able to sniff helps me find the right spot. Mom would watch me close and make me walk to her to get my exercise.
I'll follow you.
Then I wanted to go right back inside.
Good girl. You're not gonna eat. We're gonna put this back on. There you go. Oh, good girl. Such a good girl.
By day 6, I was getting along pretty good.
Come on.
I follow Mom's voice, and it's easiest when Kitty goes first. Then I can hear him walking.
Come on, Sugar. Mom went this way.
There you go. Good girl.
I feel much better. That cone is hard to carry around. It messes up my hair.
Where are you gonna go? Wanna get on your bed?
No? Not my bed. Where are you? I want to go in your bed.
You wanna get on my bed?
Yes, I want to go in your bed.
Okay, 1 second. There you go. Let's see how your eye is. Today's day 6. Yeah, you're almost better.
My eye doesn't look pretty, but it is looking better. Less bruising and not as swollen. It's healing really well. They told Mom not to touch it, so she hasn't tried to get any of the dried blood off. I'm glad, because I bet that would hurt.
Here we are, back at the vet on this very snowy day. We have to stay in the car until they're ready for her, and then I will take her to the door. She's a little nervous, aren't you, Sugar? It's okay. You did so good. The doctor's gonna be so proud of you. So we came in to see the vet, and I guess they tried to take out one of the stitches, and she's not healed up yet. Oh, poor baby. I'm so sorry, Sugar. So 1 more week, and then we'll be back.
We went back for my 1-week checkup, and the doctor thought it had been 2 weeks. That's too early to take out stitches. Mom and I were kind of mad. That spot where he took the stitch out early didn't heal as pretty as the rest, but it did heal.
You see Sugar's nose?
Eye?
Yeah, you see her eyes too, huh? Yep.
Eye.
Yeah, don't touch your eyes though. That hurts. That's owie.
Here's Sugar, home from the vet. She got her stitches out, and all better, right, Sugar? Can we have a look? Aw, that looks so much better. I don't have to wear the collar anymore. We're glad about that, right, Sugar?
Yes. I'm so glad to be done with the collar.
Do you feel so much better?
I do feel so much better.
What a good girl. What a good girl. Yes. Are you so happy? Happy to be home from the doctor?
Yes, I didn't like the doctor.
What do you think, Kitty?
I'm glad Sugar is better now, too. Now I can play with her again. She has had a rough time.
Having surgery wasn't fun, and healing wasn't fun either. Glaucoma is very painful. So now that I'm all better, I feel like it was worth it. But I feel so much better now, and I'm back to my old self. I love my family and want to be with them for a long, long time. My other eye isn't healthy either. I've been blind for a while, but the doctor said we could treat this eye with eye drops to slow the progression. I get eye drops every morning and every night. I hope I never have to have the surgery on that eye. If your dog is blind after the surgery, don't worry. It's easy to adapt. I still do all the things I used to do, I just don't do them as fast. I know my way around the house, and I do just fine, unless something unusual gets in my way, like toys or a laundry basket. Even though I know my way around, I go a little slower, just in case I bump into something. I hope this video was helpful for anyone that may have dogs with glaucoma. Be sure to watch for warning signs, and visit the vet as soon as you can. I don't like going to the vet, but I know he's the one that makes me feel better when I get home. If you like seeing things from the dog's point of view, consider subscribing. We have fun videos too.